Be inspired, informed, and up to date. Tune in to TRAXX Momentum interview feature of the day at 11:15 a.m. Join us as we speak to our panel of guests on various topics. Health on TRAXX on Monday. Tuesday, Spectrum. Wednesday, What Matters? Face to face with our guest on Thursdays. And on Friday, tune in to W Talk. TRAXX Momentum, Monday to Friday, 10 a.m. to 2 p.m. Only on TRAXXfm.
What happened? That was my favorite song.
I think the radio ran out of battery.
Oh man, how am I going to listen to TRAXXfm?
RTM Click, of course. Just log on to rtmclick.rtm.gov.my.
That's so cool. Let me check it out. Aha! Right back on track. In a minute, I'm a needle, sentimental, man, a woman to broke me up.
Feeling fussy, walking in my Balenciennes, trying to bring out the fat.
Hello, good morning and welcome to TRAXXfm, and you're currently listening to Health on TRAXX. My name is KG. Hope you guys are having a good day. Health on TRAXX, as you know it, every Monday. And today in the studio, we do have Dr Nabeela binti Azmi, who's an emergency medicine specialist from the University Malaya Medical Centre. Today we're talking about overcoming dehydration, and she rushed all the way here that she is still in her scrubs. Hello and good morning to you, Doctor.
Hi, KG. Hi. It's a pleasure to be here this morning.
All right, absolutely lovely, absolutely wonderful to have you here today. So today we're talking about dehydration. As you know, the weather has not been very great. As you can see, I'm already a bit backed up in the sinuses. Maybe I can get a consult after this.
Sure.
Right, we're talking about dehydration, right? So we start off with the basic thing. What is dehydration?
So dehydration, quite simply, is actually a fluid deficit in your body. So it can be because you are taking less, or maybe you're using up more, or maybe you're losing more. So for example, taking up less maybe because you're having poor appetite, and then using up more because you're having fever. So because of the high temperature, your body will be using more fluids, and then losing more. For example, if you are having diarrhea and vomiting, so that can all predispose you to have dehydration.
Yep, and this does not. A lot of people seem to believe that dehydration only means that you're not drinking enough water, but it can also be because your body is reacting in other ways as well.
Yes, exactly.
All right, so essentially it means the lack of fluid in your body, and by fluid, do we mean H2O per se, or is there anything else?
Medically speaking, when we're talking about dehydration, it's not just fluids, because usually along with the fluids, the electrolytes are also in deficit. So later I'll be talking a bit about how we can overcome dehydration.
Yeah, will do.
Yeah.
And how does a person actually know that they are dehydrated?
Okay, so our body is really smart. So the first thing that you're going to feel is you're going to feel thirsty. So you're going to have, maybe you felt that your tongue is a bit dry, so you're just going to drink. Some people, they waited a long time until they drink, maybe because they're occupied. So by that time, they'll feel tired. They are probably lightheaded.
Lethargic.
Lethargic. And then they're not able to concentrate. In the extreme dehydration, somebody, for example, in an elderly person in a nursing home, they can become confused, delirious, obtunded, and in the severe form, they might even lose consciousness.
Wow.
Yeah.
And that can also be something like a heat stroke or something like that.
Yes.
Yeah, right. So one of the very first early signs that you're dehydrated would be the fact that your tongue feels dry.
Yeah.
Absolutely. Does my tongue feel dry? Yep, slightly. Well, what are the factors? As you know, the weather, one of the factors would definitely be weather, but what are the factors that actually increase the risk of dehydration?
Okay, so there are various factors. Okay, the most common ones are not taking enough. So this could be because you're ill, so you don't have appetite and so you're not drinking. Maybe you don't have access to water because you're too weak to get water. Another thing is because you're having vomiting and diarrhea, like I mentioned before, so you're using up more. And another, quite simply, I think in the modern society, everyone tends to drink caffeine like it's water. But so instead of hydrating more, you're actually losing.
Yes.
So increased caffeine intake or extreme caffeine intake can also predispose to somewhat dehydration. And then the hot weather, because our fluid in the body is also connected to our heat.
Heat dissipation.
Heat dissipation, heat regulation. So if the weather is hot, then your body, because our body temperature will tend to stay at the same time as long as it's working physiologically. So hot weather and then strenuous exercises. So people who are going on hiking, or even a few years ago, we have a few cases of heat stroke from people going to concerts. Because what happened was they are dancing for a few hours and they tend to get overboard and forgot to drink. So it's also predisposed to dehydration, even heat stroke.
I've actually gotten a heat stroke when I was way younger.
I see.
It was during our religious pilgrimage, like for instance, it's Thaipusam, right? So I was 12 years old. I went walking and I was like, this is super hot. The next thing I knew, I was on the ground. People were splashing water on me.
So you probably had fainted.
Yeah, I fainted.
Oh.
Yeah, so that wasn't fun.
Yeah, I'm sure it was.
It wasn't fun.
Okay.
So yeah, heat strokes can be one thing, and also caffeine is a diuretic. I think that's the word for it.
Yes, diuretic.
Yeah, that means it pulls water out of your bloodstream much faster.
Yeah.
All right.
Some medications can also cause you to be dehydrated. Yeah, so some high blood pressure medications, some heart failure medications, because the way that they work is they cause you to diurize. For you to pass your urine. That can also predispose to dehydration. And then in a different topic, blood loss can also cause dehydration.
Absolutely.
So for example, ladies who are having menses, extreme heavy menses, so they can also be dehydrated.
So our body actually has a lot of way of being dehydrated.
Yes.
It's just that we need to regulate it very, very well.
Yes.
And coffee is definitely not one of the ways to do so.
Yeah. If you feel that you're dehydrated, probably just go easy on the coffee and drink diluted fruit juice instead, or isotonic drinks.
All right. And doctor, it's been a wonderful topic so far, but what now? We are going to be taking a short break.
Sure.
And ladies and gentlemen, we are talking to Dr. Nabeela binti Azmi, who's an emergency medicine specialist with University Malaya Medical Centre. We are talking about overcoming dehydration, because as soon as I start this song, I'm going to go have a big swig of water as well. Right now, this is Aliyah with Are You That Somebody? Don't go anywhere. I'm going to be back in just a few moments. Hey, good morning. Welcome back. You're currently listening to Health on Tracks on Momentum. My name is KG. Today our guest is Dr. Nabeela binti Azmi, who's an emergency medicine specialist with the University of Malaya Medical Centre. Today we're talking about overcoming dehydration, and we just talked about what is dehydration, how do you know if you're dehydrated, and what are the factors that actually increase the risk of dehydration. And we just heard a song, and right now let's talk about, doctor, so a lot of people always think like, okay, if I'm dehydrated, I need to start drinking water and all that. But are there any other options? How can someone actually rehydrate like super quick?
Okay, so the most common answer to rehydrate quickly, people just tend to think about water, but ideally one should try to diversify their source of fluids. So for example, try to eat fruits with high water content.
Like example, watermelon? Yes,
watermelon, oranges, and honeydews. And then if you are eating, then try to eat soupy kind of food, but try to go easy on the salt. So that would be my advice. So
go heavy on the fruits.
Yes.
Get something that is watery.
Yeah.
Try and drink water, and also like, I mean, you will feel weird, right, if you just only drink water.
Also, fruit juice is a good option as well, but along with fruit juice is the sugar.
Yes.
So what I always advise my patients is try to dilute it if you can. So you can go buy your like Peel Fresh or Minute Maid and stuff, but to drink only that is not a good idea as well.
Because of the sugar intake as well.
Yeah, because of the high sugar intake. So one is not good for your diabetes and stuff. But another thing is, if you are having high sugar, you tend to lose your water as well, because you might pee off some of the glucose. So the water follows the glucose.
All right. So how about those juices that are like, say, like cold press, that you get it fresh?
Yeah.
Then how about those? Are those also, do you need to add water to dilute those?
No, then that would be great. But just don't drink 3 or 4 at the same time. Yeah.
Don't overdo it.
Yeah, don't overdo it.
Right. So water is good. And also, how about those sachets that they give you when you have diarrhea?
That's the best. It doesn't taste that nice, but the content of electrolytes is actually specified for what you have been lost. So it has a lot of potassium, it has a lot of sodium and chloride as well. So if you want to think about potassium, think about oranges as well and bananas. You can also take those, and yogurts as well.
Yogurts as well. And also, if you're having diarrhea, yogurt's always good. They help your stomach calm down.
Yes.
And as you know, since we are talking about dehydration, Doctor, and the Hajj season has just started, and thankfully our producer, Mr. Bari, is also able to go for Hajj this year.
Yes.
Pilgrims going for Hajj, in those specific instances, what can they actually do to prevent dehydration?
Okay, so the pilgrims are at especially high risk to develop dehydration. So my suggestion is, I think they should have like a minimum requirement or a bottle that they say that, I should finish this within 3 hours or 5 hours, and they should drink water regularly. And then always to pay attention to the sense of thirst. Because sometimes they thought that drinking 500 ml is enough. But because they were doing strenuous activity, they were walking more, then they would need more. Another thing is to include fruits, if they can bring it together with them, watermelons and stuff, and to avoid caffeine in the mornings, especially the teas and the coffees. And sugary drinks is to be avoided as well.
So no oranges, sodas and all that?
No sodas at all, if at all possible. And then wear suitable clothing. So light clothing, and also white clothing is the best, because white clothing then will repel heat. And then if you have less heat, then you will be using supposedly less fluids. And then use umbrellas if you can.
Yeah, absolutely.
Yeah, and then avoid unnecessary exposure to the sun. And then regularly spray your face with water. Yeah, I think that's a good idea as well, because what will happen is if you spray water, then the heat will dissipate, trying to lose the heat by condensation. So in that sense, you will also be cooled off a bit. And in fact, that's one of the method that we use, a cooling method we use in the hospital for heat strokes.
Wow.
Yeah. Another good thing is to monitor your urine.
Okay.
So apart from the amount of urine, you should also aim for your urine to be lightly colored.
Yes.
Okay, so a concentrated urine, almost orangey like, is not a good sign. You should aim for a clear, almost clear yellow urine. So that's a good sign that you're adequately hydrated.
Absolutely. And also, if I'm not mistaken, we lose a lot of heat from the top of our head as well.
Yes.
Right? So putting a wet cloth over there would reduce the sweat output. Wow.
Yeah.
So there's a lot of ways we can do it rather than just drinking water to decrease the risk of dehydration. And that's actually for our Hajj pilgrims out there, specifically for them. But if you're working out in an environment where you're outdoors all the time, this could also apply to them, right?
Yes. People who work in open areas, constructions, people who work in events, they tend to be predisposed, to be dehydrated.
All right. So for all our fellow Malaysians who are going for Hajj, these are some of the ways that you can actually use to reduce dehydration, especially at a time when you're so focused on completing your pilgrimage. You would tend to lose sight of yourself.
Yeah.
But remember, for you to successfully complete the pilgrimage, you need to take care of yourself as well.
Yes, exactly.
All right, Doctor, we're going for another short song break. This is from the 90s as well. Possibly you might have heard this. Natalie, I have trouble pronouncing this name, Imbruglia, with Son. Ladies and gentlemen, we're going to be back with Dr. Nabeela in just about a bit.
Okay.
Be inspired, informed, and up to date. Tune in to TRAXX Momentum interview feature of the day at 11:15 a.m. Join us as we speak to our panel of guests on various topics. Health on TRAXX on Monday. Tuesday, Spectrum. Wednesday, What Matters? Face to face with our guests on Thursdays. And on Friday, tune in to W Talk. TRAXX Momentum, Monday to Friday, 10 a.m. to 2 p.m. only on TRAXXfm.
Experience the excitement right here on TRAXXfm.
Good morning, welcome back to Health on Tracks on Momentum. Today we are with the wonderful Dr. Nabeela binti Azmi, an emergency medicine specialist with UMMC. We're talking about overcoming dehydration. Now we've talked about what is dehydration and how do you know whether you're dehydrated, and of course we talked about our fellow Malaysians, some of them are going for their Hajj pilgrimage and what they can do to prevent dehydration. So doctor, what pilgrims should look out for among themselves to identify early signs of dehydration?
Okay, so I would really encourage for the pilgrims to look out for each other. So if you see somebody who is sweating excessively and looking tired, just remind them to take their water and then to rest as necessary. Initially, when you're dehydrated, everything goes according to what the body signals you. So they will make you feel thirsty, and then you'll drink, and you'll be able to respond. But once the dehydration becomes severe, what we want to avoid is a condition called heat exhaustion or heat stroke. So this is when the situation gets a bit more serious, and the person might faint initially or become confused and not able to respond to you. And then the person can also present with high temperature, fever, and then instead of sweating like the body is supposed to dissipate heat, their body tend to be very dry.
They become clammy.
Yeah, it's clammy, cold instead of being sweaty. So this you should alert any of the health officers around you because that person would need urgent hydration and cooling. Okay.
And also, if possible, try and guide them somewhere where there's shade, right?
Yeah, there's shade, and then fan them a bit with whatever things you have, maybe a book or newspaper while waiting for help.
A manila folder would work wonders.
Exactly.
Right.
If you can have.
And also, going on the Hajj pilgrimage, you got to look out for yourself. You also got to look out for your fellow pilgrims as well.
Yes.
Because, they are there for them to complete. And sometimes, as I said earlier, right, sometimes we tend to forget in the excitement and the joy that you're already there. So, Doctor, we are actually coming towards the end of our interview for today. Very, very fast today, I believe. What is your advice and also your take-home messages for patients who are actually dehydrated or they want to make sure that they don't get dehydrated in the future?
Okay, so I would advise everyone to mix up the source of fluids in your life. So take your light juice, take your fruits, and then maybe your meals, try to encompass some kind of soup as starters. And then also think about isotonic drinks if you're going on hiking or running on marathon. And then try not to overdo it as well. So if somebody drinks a lot of water and just water, they are actually at an increased risk of a condition called hyponatremia, or basically low sodium. And that is dangerous as well. And there have been cases in which people going on marathons who are only drinking water with the isotonic drinks that pass out because of this condition. Avoid caffeine if you can, or try decaf if you really, really like the taste. Try to limit them in your daily intake, and then monitor your urine output.
Absolutely, and definitely no alcohol.
Yes, I would
definitely no alcohol. That is an advice that we need to give everyone.
Yes.
And I believe that we're at the end of our topic, but there's actually one more question that I would like to ask. Right? There are some people out there, especially say for instance the younger generation who are always stuck behind computers and all that. They tend to forget to drink water on a constant basis. Is there long-term effects of constant dehydration?
Actually, it said that if you drink less water every day, you tend to increase your risk of developing
kidney stones.
But strictly speaking, kidney stones are quite common as well. So it could be genetic as well. And then another thing is, whenever you're in a dehydrated state, you're actually putting a stress on your kidneys. So probably in the long run, your kidney wouldn't be able to tolerate it.
All right, so guys, remember, take your water whenever you can.
Yes.
Whenever you should. If you're thirsty, you feel your tongue is dry, go for some water. If you like fruits, have a lot of fruits, but don't overdo that as well.
Fruits is good because of the fiber as well, and then it fills you up and you'll be eating less, so that's great.
I don't like honeydew, but I love bananas.
Yeah,
so I can eat the bananas.
Okay.
All right.
Okay.
So thank you, doctor, for coming in. And I know that you're still in your scrub, so I'm pretty sure you have a really busy day after this.
Yeah.
And I wish you all the best. And we hope to have you again in the future for another topic.
Okay. Thank you, KG.
All right. Thank you so much. And that was the wonderful Dr. Nabeela binti Azmi, who's an emergency medicine specialist with the University Malaya Medical Centre. Today we talked about overcoming dehydration. So guys, remember, water is a good friend, but don't overdo that as well. Everything in moderation, alrighty? Right now, this is Back with Girl on TRAXX. Gonna be back in a few moments.